Hello, nice to meet you everyone. My name is Eliša Papić. I'm a resident of neurology, the Clinic for Neurology at the Clinical Hospital Center in Rijeka, also working on a PhD regarding microbiome and Parkinson's disease. I'd also like to extend my thanks for the organizing committee and Ivana for inviting me, and I'm gonna tell you more about this topic. Before we start, we just need a little reminder to tell us what actually is Parkinson's disease. It's the second most common neurodegenerative disease, marked by a triad of symptoms, most notably rigor, bradykinesia, and tremor, but also with a variety of other motor and more notably non-motor symptoms that could actually precede the clinical presentation. At the basis of the pathological mechanism is the accumulation of alpha-synuclein, and mostly it is accumulated in the area of the substantia nigra, where it leads to neurodegeneration and the first symptoms. It's a multifactorial condition, and it actually affects the entire body, and we're going to actually see that its beginnings can be located in a different, unexpected part of the body. The gut-brain axis has been implicated more and more in the development of neurodegenerative diseases. It's a complex bidirectional system of communication between the gut and the brain. There are different paths to which this effect is established. One of the most notable ones is the vagal nerve. It's been the most explored ones through a retroneuronal transport of certain pathological protein conformations. And in the case of Parkinson's disease, this has been postulated and shown to be the case with alpha-synuclein. We can see actually the pathway. It's a long way. It's been known to be the longest nerve and the traveling nerve of the brain. Besides the vagal nerve, we have a wide array of systems which are implicated in the gut-brain axis, most notably the immune system, neuroendocrine system, circulatory system, and various secreted peptides and immune biomarkers that can actually influence changes in the brain and actually are initially observed in the gut. We can see that this axis has been implicated besides in neurodegeneration and some neuroinflammatory diseases such as multiple sclerosis, but also in the case of brain tumors and circulatory changes, such as in the case of brain ischemia and hemorrhagic stroke. The idea behind it, and it's being more and more explored, is that there is a dysbiosis which affects actually the permeability of the gut, which in turn modulates the inflammatory response to certain either input food or diet products or absorption that can actually lead into the enteric glia activation, alpha-synuclein aggregation, and retrovagal transport. This is still hypothesized. However, it's been shown in studies around, I think, 2016, that there is actually a variable cause for neurodegeneration. This is important because we learn more and more microbiota composition, which is actually the main modulatory element in this whole system. There's been noted changes in its composition, both in PD patients, but also more notably in Alzheimer's patients. There's a difference between healthy controls and these kinds of patients, as well as certain markers that can point to their metabolism, such as short-chain fatty acids, but moreover, other mechanisms. And the changes in microbiome could potentially lead into prodromal symptoms. One of the most common ones is hyposmia, which can show up decades before the appearance of the disease, and gastrointestinal dysfunction. This, however, is still not elucidated whether it's the cause or it's the result of microbiota changes. They could influence changes in motor function at later stages of disease, which has been shown in this study. And they also have been shown to be connected to response to specific therapy. We can thus speak, besides genetic types that react differently when we look at pharmacogenetics, it's going to probably in the future be more apparent there are certain gut types with different microbiome that could react differently to levodopa and other specific Parkinson's disease therapy. We can see a wide array of factors that can affect this microbiome, be it from geographical standpoint, from diet standpoint, from gender, sex, and other certain factors that can actually change our whole makeup of microbial organisms in the body. The link has been shown most notably in the relative abundance symptom correlation. When we look at the symptoms, we tracked it through UPDRS1 and YAR disease progression scales, as well as non-motor symptom scales such as NMSQ and cognitive scales such as MMS and MOCA. We, as part of the research we're conducting in Rijeka, we did a little systematic review to see whether or not it's been explored and to which extent, whether or not microbiota has a certain influence of these scales. We have found that the relative abundance of microbiota mostly positively correlates with motor symptom severity. It's also, when we translate it, there's a certain group, a higher group of certain microbacteria can actually evoke a higher instance in the scales, meaning more severe symptoms. In the case of Taxa bacillota. In some cases, more actually is better. We got prevotelaceae and lactospiraceae that have shown a negative correlation in motor symptom severity. What this means long term, that various confounding factors have to be taken into account because we don't know whether or not the numbers directly influence the symptoms or there are some more mechanisms at play that could influence be it the neurodegenerative process or the intensifying of the symptoms in these patients. Some bacteria have a higher relative abundance when compared to other bacteria and their taxa, meaning that their number per se is not increased. There's a relativity at base, but other bacteria are decreased, and when we look at the ratio, there we get the higher abundance. SCFA and other metabolisms and their metabolites are still not explored enough. It's still in the phase of experimentation, and then more and more research is actually required to elucidate the link. So when we look at it, there's a balance at play that needs to be kept. So we can have most healthy benefits of our diet and our microbiome composition. Why is this important? Because when we look at all this, we can actually influence our microbiome composition with either application of antibiotics, probiotics, or modifying our diet, or certain more modern approaches such as fecal microbiota transplant. Antibiotics have been shown in certain rat studies that can actually regress, and actually they can reverse the changes that have been caused by MPTP. For instance, MPTP has been long implicated, and it's a pesticide long implicated in the appearance of Parkinson's disease. And an antibiotic cocktail, ampicillin, neomycin, and metronidazole actually countered the neurotoxic effect. In a different study, rifampicin has been shown to inhibit alpha-synuclein fibrillation, which is also interesting when you look at neurodegeneration. When we look at probiotics, this is important because they've been mostly popular in the Western culture for more than a couple of decades. It's more important because certain bacterial taxa has been shown to be more beneficial than others. This is the case in, for instance, lactobacillus, while others that have been long added to probiotics such as Akkermansia, which has been shown to actually in these studies that have been conducted, shown to be linked to more severe symptoms, should be taken into account, because if we decide to treat our patients supplementary with probiotics, we need to look at the composition, because depending on which bacterial taxa is more represented, we can have more severe symptoms. The Mediterranean diet, which has been known to be beneficial in Alzheimer's, has also been shown to be beneficial in Parkinson's. This can actually also be linked to lactobacillus, in which this diet is high in composition. Fecal microbiota transplantation has been tested. However, it's been tested in a small number of patients on a small group of 10 at a study in 2020. It's been shown actually to decrease both motor scales such as UPDRS3 and non-motor scales such as Hamilton anxiety and depression scale. The problem, as I said before, it's limiting because it's only 10 patients. And besides this, interventions to the gastrointestinal system have been tried in the form of enemas. For instance, patients that have been applied with varied enemas have been shown to have an improvement of symptoms shortly after. What we're doing in Rijeka is not that far off. We're trying to actually evaluate genetic factors and microbiota, as well as a way number of immunological markers in drug-naive patients, so patients that have only been recently diagnosed with Parkinson's disease, so we can track better the progression and changes depending on therapy and disease progression, both in microbiota and other factors. We have 2 research groups, 50 patients each, one group of drug-naive patients, other healthy. Inclusion criteria, of course, is Parkinson's disease. Diagnosis according to the Movement Disorder Society clinical diagnostic criteria, and exclusion factors more pertain to certain diets, certain inflammatory states of the gut, etc. We applied epidemiological questionnaires. We actually already did the initial phase. We're at the control phase, almost at the end point. Regarding genetic questionnaires, sleep and biorhythm questionnaires, nutrition, lifestyle, and stress questionnaires, as I mentioned before, this is all can be linked to actual microbiota composition, and we also know that stress and sleep changes can actually be linked to Parkinson's disease emergence. Exome analysis is conducted from DNA from extracted blood samples using genes validated in PD and using validated protocols. Genes, of course, that have been long before shown to actually show that can actually cause Parkinson's disease. And analysis of microbiota composition is a problem with translation. It's done from the feces and the saliva of the patients, also through already validated protocols and using regions that have been shown in various previous research to be the best for analysis. Analysis of microbiota metabolic function is used mostly through liquid chromatography tandem mass spectrometry using these acids. Endgame. So we're looking actually at a clearer correlation that we can add up to all the earlier research that's been done in this field, correlating besides with the genetic factors and inflammatory markers such as interleukins, also using various neuroradiological markers such as MRIs and transcranial Doppler. We're actually trying to see a more detailed correlation between all these factors that can actually lead to new potential therapeutic targets for future patients. And thanks for your attention.